So I'm just going to go undo all for what Terry's done, and I'm also going to select a different tooth. I like this tooth library, I just like it. Don't ask why, what I use on all my patients. Okay, so this is where we're starting, okay? So this puts it in relation to the dots you've made and the occlusal plane you've established. So you can go, oh, it's way off and I'm going to go back and change those, but really you're almost better off just moving it at this point. So if I'm assessing this occlusal plane should be coming about 3/4 of the way through these retromolar pads. So I'm going to correct this like this. And if we turn these lowers off and we see this is our occlusal plane, can you see what I'm saying here? So you can actually turn the teeth off and start to adjust it this way. It needs to come a bit that way. There's our midline through there. Then what I'll do is we'll put the upper anterior teeth on, turn our bite block on, and for this case, this bite block is way far in, so bring it further out, okay? If we were doing this to a real case, they'd have a bite block, they'd have the contour there nicely, exactly where they want it. But this simulation case, it's not really correct. So we're gonna have it a bit forward, and what I'm looking at is, I'm looking really at where this is in relation to this ridge here. So I might actually move this around a bit like that. Now if I turn this on, you see if we have that 3/4 of the way up the retromolar pads. Beautiful, okay? Got enough room. So that's really the first part done there. So notice I've used everything in this global occlusal plane adjustment. We work from left to right. This particular tool here, I'm really not a big fan of. It's good for some things, like if I had more difficult cases where I needed to bring all these teeth down, it's good. But see how it brings them down almost like a bit of a rubber band? And if you do that too much, what's this? See how it'll sort of bring these a bit uneven? Oh, that wasn't a very good example. If I bring these out here, you'll start to sort of stagger them and they'll all get funny. So I prefer to avoid that tool on uniform cases like this one. It'll also throw your overbite out. I would normally use that for like immediate or patients that have got something that's very overclosed. So the next point we're going to move to is we're going to move to this, just trying to grab what doesn't come up with a name. This third one across. So the first thing I do is I look, the lower denture needs to be over the ridge to be stable. So the positioning of our posterior lower teeth is probably the most critical part to a functional denture. So I'm going to turn my top teeth off and we're going to move these out here and we're going to move them in. And if we put these sort of half view, can you see what we really want to achieve is having these teeth, the middle fossa over the ridge there. Can you see how that's over the ridge? And that's dictated by this green line where we put those marks. So those markings help us to set our teeth. Have a look at this side, yep, that looks pretty good. If you want a super check, you can get our cross-sectional tool here, and we can actually come across through here. So if I'm looking at this, we want this cusp to be over the ridge. I can see here on this side, we actually need to come a little bit further out. Bring this back here, good. So when I'm setting them for real patient cases, this is what I do, guys. And I've probably set 300 or 400 cases like this now. So I've got my technique down pretty good. So we're going to have a look at our other side now, over here. having a look at our ridge. See that cusp is coming just onto that ridge. Wait a minute, I'm gonna... You see here, ridge. Can you see what I'm saying? That's what we're trying to achieve here, guys. So we've got those teeth set over the ridge. Now, look at our anteriors now. Not real good. Oh, they want to come in.
Yep.